Hi, I wanted to talk to you about penile rehabilitation or erectile preservation, the program to help preserve your erections after your surgery within the pelvis. The most important concept of this is that we need to keep your erections going so that you maintain function. These are surgeries typically for cancer, but it can also be for non-cancerous reasons. Some of the cancer surgeries include removal of the prostate, prostatectomy, removal of the bladder, cystectomy, and removal of the rectum, whether it's APR or LAR, various procedures for rectal cancers. The main concept behind this is that if you don't use it, you lose it. Very true. So now imagine if you have an injury to your arm, your bicep muscle, you have it in a cast for a year. During that year, at the end of the year, that muscle is going to have atrophied. It's going to be smaller, it's not going to be useful, it's not going to be as strong. Same thing happens to the muscles within the penis. The penis, there's smooth muscle, it's a different type of tissue, versus the skeletal muscle that's in the bicep. So in the penis, after 1 year of not having erections, you're not going to have the same recovery that your bicep is going to have. There is a process that happens where the muscle undergoes atrophy, but things change to the tissue so that it's no longer muscle tissue and it becomes fibrotic tissue, scar tissue, however you want to call it, but it's not working like muscle again, and you're not going to get the erections. So our goal is to prevent that from happening. How do you prevent it? By maintaining erections. So the keys to the program: you have to have erections. Number one, right after surgery, we take it slow. We start out with 1 erection per week. Do that for about 6 weeks. How you do that, we'll talk about a little bit later, but the goal is at least once a week, you try and get an erection. About 6 weeks to 8 weeks out, that's when you start to increase the number of erections per week to at least 2 per week. The normal male has 3 to 5 erections at night while they're sleeping. We're trying to replicate that at a minimum of just getting 2 erections per week going forward. You get the erection by either taking a full dose of a medication like Viagra or Cialis, and you have to stimulate function. You have to get the erection, try to get the erection. Those medications are a boost to your natural function, but we need to know if you're going to respond. So the first 6 weeks is really a trial phase to see if we need to use something stronger, likely injections. Penile injection therapy, great way to get erections, but if you respond to pills, great, we'll stick with pills. If you want something stronger as far as a stronger erection, you're just getting borderline erections, hard enough for penetration, borderline penetration, and you want to go higher to next level, that's when injections come to play, and we can hopefully use it just as a bridge until your erections recover normally. But you need to have erections. The second part of the erectile preservation or penile rehabilitation program is to take a low dose of the medication like Viagra or Cialis. This low dose of the medication is to help preserve the cells lining the blood vessels, the endothelial cells. That medication keeps those cells happy, and it only takes a low dose and it lasts long enough so you only have to take it once a day. This is not enough to get an erection. Do not expect to get an erection from this low dose of the medication. 20-25 milligrams of sildenafil, Viagra, 5 milligrams of Cialis. It's not enough to get an erection. If you get an erection from it, great, you're doing perfect. But I don't expect erections from this. This is purely to keep those cells lining the blood vessels happy and healthy. So to recap, number one, low dose to keep the cells lining the blood vessels happy, the endothelial cells. Low dose every night, except for the nights where you're taking a full dose. So that's number two, a full dose of a medication like Viagra, Cialis, sildenafil, once a week in the first 6 weeks after surgery, and at least twice a week after that 6 to 8 week period after surgery going forward to try and get an erection. if you do not achieve a full erection, you need to let us know, and we'll boost you, get you in for training for penile injection therapy. It's a stronger medication to get the erection, because that's what you need. You need the erection to exercise the muscle within the penis. Normal recovery after a pelvic surgery that puts the nerves going to erections at risk, we typically see a slight decline after surgery in the first 3 to 4 months. Then it's a steady state until about 10 to 14 months out, where we start to see the nerves wake up. At that point, we start to see nerve waking up until about 18 to 24 months, where it starts to level off, and we don't see much recovery afterwards. There's still some, but it's not really, that significant. That's the normal recovery after a surgery that's going to put the nerves going to the penis for erections at risk.